Today we'll discuss operations management in healthcare industries. Hospital is a highly challenging workplace. There are numerous bottlenecks that deteriorate the productivity and the efficiency. Brand reputation of a hospital depends on how quickly they resolve the issues, raising without compensating the quality and the patient satisfaction. Operation management team is responsible for managing all operating processes of a hospital, that is all clinical and non-clinical departments. Healthcare operations involve administration, financial, legal, quality improvement activities, the core function of treatment and payment. Healthcare operations management is essential for efficient functionality and provision of the health service. Operation management is to design, operation and improvement of the processes and systems of healthcare services. The goal of operations management is to provide effective healthcare. Maximization of bed management and usage of hospital facilities is the goal. Streamlining and optimizing utilization of various assets, including high-tech equipment. Wait time for the patients at various departments and processes need to be minimum. Here I would like to say, these days the cost of the diagnostic equipments are very high. For example, a color MRI machine costs around 10 crores of rupees. So if you can afford a color MRI machine and spend 10 crores, yearly your interest only of the bank will be 1.5 crore. And to run this machine, that is to payment of your fees to the doctors, payment of fees to the technicians, repair, maintenance, etc., will be at least another 2 crore. So 3.5 crore will be there expenses where you will not make any profit. Now 3.5 crore if you have to get, then per day average you have to have at least 1 lakh rupees worth work. If a per patient it costs 10,000 rupees, so you must have regularly 10 patients minimum for this high cost equipment. So sometimes we feel bad that if doctor are asking us to go there and do the MRI and all that. But you know, unless they do it, they will not be able to provide this machine. And these machines are very critical for some of the treatment. So this is what it is the fact that you have to have this machine, and doctors will recommend you to do this test. Sometime, you know, maybe in doubtful cases also, but if proper diagnosis has to be done for some particular type of disease, this machine is to be installed, and installation cost is so high. Similarly, all machines today are very costly. So to run a hospital, the operation management must be very, very efficient so that there is no drainage and the maximum utilization of the equipment, beds and manpower is done. Waste, fraud and abuse of resources are the challenges in a hospital. All hospitals involve multiple departments, numerous activities, intertwined processes, involvement of staff at different levels. Today's hospital facing major challenges in maintaining patient safety, in technology upgradation of hospital and security. Hospitals are the second most energy intensive buildings after restaurants, and globally healthcare costs are on the rise. Financial challenges and hospital productivity, reducing the risk of infection, must avoid power failure. You know, we have recently seen some people, I think 19 or 20 people have died in the ICU bed because suddenly there was a power failure and the starting of generator took about 20 minutes time. During this 20 minutes time, many people have died because they couldn't breathe. So that way running a hospital is a very difficult job for a operations manager, and operations management must be very, very knowledgeable and very active to keep the reputation of the hospital and to keep the safety of the patients. Healthcare facilities are often 24 hours, 7 days a week, and those visiting are often under a great deal of stress when the life and health are at stake. Violence, infant abduction, patient wandering around, and theft of drugs and hospital assets are major concern for the hospital management. Hospital security, the well-being of the patient is the key to reducing length of stay and preventing readmission. In green hospitals, patients are discharged on average 2.5 days earlier compared to traditional hospitals. Patient satisfaction affects a hospital's revenue. Technology has brought about many improvements in healthcare that have a positive impact on the patient's experience in the hospital. Some facilities are using tracking technology originally designed for supply chain management. Here I like to say, during about 20 years back, my mother's knee replacement was done in a reputed hospital of Calcutta city. It took about 15 days before she could move around, and she was discharged from the hospital. Today, I understand in Hyderabad city, the knee replacement are done in the morning, and the afternoon they take the patient out for walking, and after 3 days or 2.5 days, they release the patient. And they fly back to Calcutta in third or fourth days. It makes a big difference in lowering waiting time and improving the treatment. Technology upgradation is very important. More hospitals are seeing their operations suffer as the number of insured patients grows. Number of specialty doctors and staff dwindle because number of hospitals are not the colleges are not enhancing, but number of hospitals are enhancing. So there is a huge demand of the specialist doctors. So it is very difficult to keep a specialist doctor, and it costs a lot of money to keep them. So ultimately the cost of treatment enhances and hospital charges higher rates for the patients, and that creates some misunderstanding between the patient and the hospitals. And another thing is that most of these things are coming through insurance. So a lot of paperwork has to be done by the hospital, which was not the case previously, where the patient used to pay directly. Today, you have to get it from the insurance company, and they take a lot of precautions to ensure that their money is going in the right places. How to resolve the challenges in hospital or in healthcare system is a challenge to the operations management team. The ultimate destiny of every hospital depends on the render quality service at low cost. Operational healthcare goals. The private sector entrepreneurs operating healthcare facilities are focused on effectively achieving the following key goals. Achieving these goals are: improve the quality of service in a time-bound manner, reduce medication error, improve clinical effectiveness, use business intelligence and data analytics, improve financial and administrative performances, reduce readmission, enhance member or patient satisfaction. Here I would like to say, some of you may be feeling that why I have to learn all these things, I am doing mechanical engineering and all that. But remember, there is nobody in this world who is not affected by health problem at some stage or other. Some stage or other, you have to go to the doctors, you have to go to the hospitals. So it is better we know how a hospital operates, and the operation management plays a very, very vital role in the hospital keeping its reputation and keeping the patient service, etc., etc. Efficiency of healthcare facilities is a relative term and has multiple domain-specific definitions. Efficiency ultimately translates to added value and improved performance outcome. Revisiting the importance of infrastructure and the facility management in healthcare organizations, it is more often the forgotten information which can play an important role in operational continuity, optimization, and continuous improvement. Operation management in healthcare industries incorporates the planning and operational practice that significantly reduce or eliminate the negative impact on the clinical service continuity in the healthcare facilities. This level of complexity and the number of variables involved in determining the right and the reaction under certain conditions can be done with the aid of technology. In operations management in healthcare must use latest technology in the maximum possible way, because technology really helps reducing cost to the hospital, reducing cost to the patient, and improving the reputation. All the healthcare leaders must meet team members always with positivity impact those around the task. Develop and assess issues to create the best approach and delivery system that meets the need of their staff and patient. Here I like to say that cooperation, all the staff, even from Jamadar to the chief medical officer, is very important. I was admitted in a hospital for operation. I was there for about 5 days, and I was so impressed with the service of the sisters that I go on telling my friends that you must go to this hospital, because their support system is excellent. The sisters behave as if they are your own sister, and they want to reduce your pain. So that way the sisters, then the cleaning agent, the front desk, etc. also plays a very, very vital role. Doctors are generally good everywhere, but after treatment or after patient care done by the staff member, and the staff member must be motivated by the leaders so that they can feel that they are doing such an important job, and it is because of them that the hospital or the medical institution gets a good reputation or a bad reputation. Healthcare operation team must be able to provide direction and guidance to the organization about the roles, responsibilities and functions of all levels of employees. The leader must devise and revise strategies so that everyone can understand and follow. Here I like to say the operation management plays a very, very vital role, because doctors normally are not good leaders. Doctors are normally not good leaders. They will do their job and forget about it or go away. And when required, they will come again. But you know, a patient who is in a great problem, he requires a lot of psychological support and the comfort, and that can be given by the other staff members, sisters, then general duty assistant, then front office, etc., etc., all the people who are involved in the hospital. So operations managers' main task will be to provide leadership and to provide coordination amongst all, so that everybody feels that he is doing the service to the humanity, which is true. Serving a patient when he or she is in a great problem is a great service to God. Ultimately, decisions made by an individual manager affects the organization's overall performance. So work with a team of evolved person. All members must feel proud to be associated with a particular organization, and there operations management plays a very, very vital role. It is because of the operations management efficiency that a hospital makes a good name or a hospital makes a bad name. Thank you. Thank you very much.